That wasn't the only thing happening today. Let's get to some other developments and further evidence of how COVID-19 millionaires were made by the lax procurement process at the Kenyan Medical Supplies Authority came out on Tuesday. Parliamentarians interrogated yet another enterprising Kenyan who walked into KEMSA empty-handed and walked out a multi-millionaire. Olive Burrows tells us how they made a killing at the expense of the sick and dying.
Said here, and it's here. I'm not the one who wrote this letter. Correct. That you imported some of these kids. Correct. So you have been misleading this committee all through.
I've not been misleading the community. I'm going to say this. I used other people's language because they are the ones who had already imported.
This is a document authored by your co-director.
Yes.
So you cannot tell us here that you are using other companies. Did you import or not?
We did not import.
Tuesday's sitting of the Public Investment Committee of the National Assembly proved a stormy one when the jaw-flexing Joel Ndegwa, a director of Melton Enterprises, appeared before it to defend a 225 million shilling tender he won from the Kenya Medical Supplies Authority to supply personal protective equipment.
They say COVID-19 current market environment impact on procurement, okay? This is written by Copenhagen, and they say they're going to be new suppliers. I'm familiar with the UN procurement. Significant price increase.
All right, Joel, if you tell me that this is a document from Copenhagen, Copenhagen is a city.
Yes.
Nairobi is a city.
Yeah.
Kenya is a country. This is a country that has its own laws.
Is there any law that are broken?
Yes, there is procurement law. There is procurement law, Mr. Chair. Remind the witness that there is procurement law.
I think I'd already done that. I don't know whether you were not around, but
the witness knows about the procurement law. So it is not like he's going to a shop to buy jugu.
Ndegwa was hard-pressed to explain how all it took for him to secure the tender was to send in a proxy, a banker by the name of Margaret Murage, to meet with the procurement manager, Charles Juma, without so much as producing a quotation.
Did you have a commitment from anyone that they can be able to give you these 30,000 pieces?
All you needed was to have the money and the job. They did the reverse procurement, in short.
All you wanted was to catch in and crush KEMSA, not to supply and save lives. So your R&D was about making a kill. It's blood on your hands, my dear.
Though he denied his wife and company director Lydia Kariuki is related to the KEMSA CEO, Jonah Manjari, he had no rejoinder to the revelation that at the time his company secured the tender, that is in April of 2020, KEMSA stores were already saturated and lower bids of 4,950 were turned down in favor of their more expensive PPE kits valued at double the price.
How is it that people who are so interested and who invested lots of money and have shops in Kenya are not able to walk through the gates of KEMSA to find that there is activity going on, but one Lydia or Margaret walks in casually?
In Iraq.
Yes.
I am not aware about that. And I did not have connections. If I had connections, I would be paid my money in full.
You were paid within a period of about a month, isn't it?
Correct.
Despite pocketing a cool 117 million shillings as a middleman, having purchased the PPEs locally, then resold them to KEMSA at an exorbitant price, Ndegwa maintained that he and his wife were not COVID-19 millionaires and simply forecast a need for the PPEs in January of 2020, cashing in on the business opportunity.
I'm used to clever Kenyans, but today I've met a prophet who in January sees Corona coming, that then he decides that this is where to anchor his business and sends Margaret to walk into KEMSA offices, and lo and behold he finds that there is procurement.
Olive Burrows, NTV.